So, before I start the health nugget, I want to ask a question and I really expect an answer. Is it normal to have memory loss as we age? Okay. Wow. I didn't expect that. But yes, it's not. And this is a two-part series. I wasn't able to fit everything in one presentation, and I don't want to just rush through something that's very needed and very important for us to be reminded of. So, as you said very, very clearly, memory loss is not part of aging. And that's a very hopeful statement on itself. So if any of us are experiencing that, that means that we have to work something out, because that's not part of the norm. So don't think that you have to have it, okay? Now, it's very interesting to know, we've talked about the brain, a lot of things, and sometimes we think that, as we age, everything just wears out. Like, the muscles, as we can see here, even the greatest athletes, after they pass 35, they are losing some muscles. And but the brain, the good news, again, another good news, it's not built that way. So it's not like as we age, it should wear off and not be able to use it. No, that's not the case. So praise the Lord for that. So you probably heard about this powerhouse. It's called mitochondria. So God allows us to have this in our brain so that it's constantly keeps our brain cells working in such a way that it will not age. So that we can become totally disabilitated on using our brains. So that's a good news. Now, this is something, again, I forgot to mention, whatever we are sharing here, it's not medical advice. It's just for educational and raising awareness purposes. Please continue to follow with your primary care provider. And also, what I'm sharing here, they are not my own words. I have all the reference at the end. It's based on scientific evidences. So this comes from the, actually, Alzheimer's Society. About 1 in 9 Americans over 65 is living with Alzheimer's dementia. And roughly 1 in 3 by age 85, according to the Alzheimer's Association. It's very kind of concerning. And I'm visiting lately more assisted living / nursing homes, and it's kind of sad to see this is a reality, and it saddens my heart to see that, just let's put it that way. So this is a serious concern, and while this is a very, very bad news, I do have some good news. Now, this is something that probably you don't see it a lot on the news, but what does it say? What percentage can be prevented? That's a lot. So, and this comes from Lancet. Lancet is a very, very credible medical source. Like the greatest articles, when you quote, it comes from Lancet, it has a great standing. So these people are saying that more than almost half you can prevent, or delay, by addressing modifiable risk factors across a lifetime. So this is very hopeful, and I hope that you're really paying attention to this. It's not something that we cannot deal with. Yes, most of it. Now, can everyone reverse it? No, because there are different other issues, but the majority looks like we can prevent it or delay the onset. Now, what's really behind the memory loss? So I'm sure you are familiar with Alzheimer's. It's a neurodegenerative disease, like Alzheimer's is a lot of people that are afraid of. So there are vascular problems. Now, just think of vessels like pipes. It's the easiest way for me to explain. When the pipes are clogged up, even in your house, have you had your pipes clogged up in your house? What happened? The flow is very slow. Like, try to take a shower when the pipes are clogged up. Have you tried that? Like, just drips, drips, drips. You don't get the flow you need. The same with the brain. If the blood vessels in the brain are not free of, blockages, the blood cannot circulate freely. What do we learn? Perfect health requires perfect circulation. That involves the brain. So the blood needs to go to the brain. Why do people have a stroke? And some of them even die because there is the blockage there stops the blood from going through, and some people remain with a lot of deficits. So it's a lot that has to do with circulation. It's a vascular problem. So now, do we have any remedies to try to prevent the blockages? Yes, we do. So we don't have time to go into all this. What I just want to bring to you right now, it's the fact that everything we do, every choice we make will influence our lives in a good way or in a bad way. What's in your plate will also determine if that quality of blood that's formed from that food will help your brain be healthy or will damage your brain. Just think on this way. Whenever you struggle, should I eat that or should I eat the other? Think of your brain health too, not just on your taste buds, okay? So, what's really behind the memory loss? The first is lifestyle and attention. So, chronic distraction. What's connected with chronic distraction? Give me one name. Phone. Or media, or it's a gadget, chronic distraction. When do you get distracted? Oh, I'm hearing what do they call? Because I even turn off all my notifications. I turn them off because it's just so distracting. It's like you try to do something and boom, notification, your brain gets distracted. And it's very hard. This is becoming a very serious situation. We cannot focus. And when we cannot focus, that affects our brain. Because the brain needs time to focus. When you read something, you have to think about it, to try to digest that. As we digest food, we put food in our stomach. It takes time to digest and get the properties out. Put food in the brain, that's the same thing. So, lifestyle and attention, chronic distraction, poor sleep, inactivity, alcohol, and especially the use of screens really affects the memory. I know we keep hearing this over and over, but it's becoming a very serious issue, and some schools are now initiating to stop allowing using phones because the students are just out of control. They're not able to learn anything. They're becoming more depressed, and it's because of that. So the brain that is never allowed to focus slowly loses its ability to. So when you go fast through all these things, your brain kind of goes like this, and at the end you haven't got anything out of it. It's just your brain wiring like that and weakens your brain. So let's keep that in mind. Okay, so the second surprise is that even physicians, memory loss driven by mental illness. So this information comes from, I get newsletters from Dr. Nedley, and he reported how he treated patients that they were referred to as having Alzheimer's, but actually deep down they had severe depression. And when they dealt with the severe depression, their memory and everything returned to their normal function. So it's not always when you have memory loss, and we've experienced that in our own family. One of our family members, he was so down with a lot of losses, like a lot of losses in a very short time, that everyone thought that he has dementia. In reality, we don't believe it was dementia. It was the losses that he was experiencing one after the other and got him into a deep depression, and it's called like pseudo-dementia. And sometimes it's treated like dementia, and that can also affect. So that's something else that we need to keep in mind. The person who we are seeing having problems with their memory, let's look into maybe they are very depressed, and that can also be taken care of. So there is a lot that we can talk about it, but we don't have time. So just a little bit of chemistry here. So to understand how to support memory, it helps to know how a memory is actually made. So a great deal of it comes down to a single brain chemical, acetylcholine. Acetylcholine is the messenger your brain uses to form new memories, retrieve old ones, and hold your attention on what's in front of you. The stronger and cleaner that signal, the sharper your thinking tends to feel. So it's that brain chemical. And then as we age, two things works against it. The brain makes less of it, so production slows it, and the brain clears it away faster. So there is an enzyme that tends to break it down, and that's why sometimes you can get problems. So when both happen at once, memories become harder to form and slower to surface. But now there are good news that also this can be delayed or prevented. And guess what? To be continued. I have no time to share more, but I do have the references, and I do want to tell you, you are allowed to forget something. As Philippians 3:13 says, forgetting what is behind and straining towards what is ahead. So forget your past, forget whatever held you back from advancing your Christian walk. And then we'll talk on the fourth Sabbath, we'll talk more to see what we can do to prevent memory loss. May you be blessed.